April is Head and Neck Cancer Awareness Month, a critical time to shine a spotlight on a disease that often goes undetected until it's sadly too late. Today, we are specifically focusing on the link between HPV and head and neck cancer. Joining us today is Dr. Akshay Patel, head and neck surgical oncologist and co-director of head and neck oncology at Hartford Healthcare. Doctor, good morning.
Good morning.
First, let's start by telling us what HPV is and, of course, the link between HPV and head and neck cancer.
Sure. So HPV, or human papillomavirus, is the most common sexually transmitted virus in America. Most Americans are infected with the virus at some point in their lifetime, but thankfully, for most of us, our immune system will get rid of the virus. But for 1 to 2% of us, the virus persists. This virus is known to cause cancers of the cervix, the anus, and even the oropharynx, which is the tissue in the back of our tongue, or our tonsils.
And you said a lot of people may deal with this in their lifetime, but who specifically or typically is at risk?
So as you mentioned, yes, most people will get the virus. Only a few percentage of folks will hang on to it. But the most common demographic of patients who develop human papillomavirus-associated cancers of the throat, or the oropharynx, are usually men in the ages of 50. Men beat women to this in a ratio of 4 to 1. We have taken care of patients as young as in their 30s and even patients in their 90s. Most patients will present with a neck lump that doesn't feel any pain. Some patients will experience throat pain or the sensation of something stuck in their throat. That could be signs of this problem developing.
And what should you be looking for? I know we said at the top here when we came back from commercial break that unfortunately people find head and neck cancer when it is too late. So you just mentioned some of the warning signs. What should we be specifically looking for, and when do we know it's time to see a doctor?
Sure. So the most common presenting sign for a patient who has a problem like this is a painless neck lump just underneath the jawbone on the right or left-hand side of the neck. Less commonly, patients will notice a lump in their throat, or their primary physician may notice a lump in their tonsil. Some patients will have persistent difficulty swallowing or throat pain, and less commonly, ear pain. And a biopsy can usually help tell us whether a patient has this problem. That biopsy can be from the lymph node itself, or from taking a sample of tissue from the tonsils or the back of the throat.
All right, and let's now talk about treatment options.
Yeah, so treatment for human papillomavirus-associated oropharyngeal cancer are very good. The prognosis for this is very good. Patients have a 5-year survival of 85 to 90%. And treatment can involve surgery, which is typically done in a minimally invasive robotic approach through the mouth. They can have radiation, and in some cases, even chemotherapy. Our goal here, though, is to treat patients as minimally as possible because the prognosis is so good.
And I know there are...
And the treatment is best... Oh, excuse me. I was saying the treatment is best done from an individualized approach, and usually using a multidisciplinary team like the one we have at Hartford Healthcare is suitable for most patients.
Wonderful. And I know there are HPV vaccines. Let's talk more about the vaccines that are available and who should get it and when.
Sure. So human papillomavirus has a vaccine available. It's the Gardasil 9 vaccine. It's a 9-valent vaccine. It's FDA approved, it's safe, and it's effective. The vaccine can be offered to patients from 9 years old all the way to 45 years old. Most patients start the series between 11 and 12 years old, and it's about 3 shots. What's really great about this vaccine is that it has the potential to significantly decrease the incidence of this cancer over the next 25 years. And not only this cancer, but also cervical cancer and anal cancers too.
Wonderful. Well, Dr. Patel, we appreciate the work that you do and, of course, your time with us here on Good Morning Connecticut.